And we turn now to New Mexico's Democratic Governor, Michelle Lujan Grisham. It's good to have you back here in studio.
Well, thank you, Margaret. I'm happy to be here.
So your state is part of a 20-state coalition of governors, the Reproductive Freedom Alliance. Some of the states in it have started stockpiling this medication for abortion. When you were here in February, you said that's the wrong focus, the wrong question.
Well,
has that changed?
No, for me, it hasn't changed. And we're going to make sure, and we already are, that we have access to all of those medications. But if the response is we'll stockpile instead of protecting all access, then we're minimizing the work that we have to do to make sure that women and families are fully protected. Not that in and of itself, there's a disagreement by a state that's making sure that irrespective of the legal decisions, we're going to make sure that medication abortion is available in our state. But I think that we are moving, and to Jan's point, it's every social issue that you disagree with. Is it stem cell research? Is it fertility drugs? Whatever it is in this context, if we're going to use the federal courts as a way to bar and ban access, we are looking at a national abortion ban and more. And I think states have to band together to do as much as they can in opposition to that.
And the states are on the front lines here because there is no federal guarantee. The court kicked it back to chief executives like yourself back in June. So currently in New Mexico, abortion is legal, but you don't actually have a law codifying it. I know you want to write one.
We do now. So the last time I was here, we didn't, and you were, and thank you, talking about Colorado's work. We now have a law both codifying right to abortion, abortion care and access, as well as gender-affirming care in the state. So that just got signed by me.
So nail down for me then, how do you define, because up till now, my understanding is there wasn't a limit on when in a pregnancy, a woman could receive an abortion. Have you set any limit on it?
There are no limits. So for us...
That's very controversial.
It can be. I mean, look, it's the 1% of all abortions, and that's still a sizable number of abortions worldwide.
1% over 21 weeks of pregnancy.
Correct. However, you know, look, these are women that have named these soon-to-be-born babies. These are horrific medical conditions. And again, New Mexico's position and mine is that we should not be interfering with a woman's medical situation and her decision about that life-threatening potential circumstance. We shouldn't be doing that.
Explain that. How do you define fetal viability or that line?
So
you say it's very, very uncommon, but...
It is. That is not defined. It is left to two physicians make that decision with the patient. That's the issue, is that the government's two physicians.
And so the fear is that folks could take that to an extreme if someone has an affliction that isn't life-threatening.
Well, of course. And
that they're picking and choosing which children they want to carry to term or not.
I find that argument not to be nearly as compelling as the arguments that we make, that we should be focused on contraceptives and better maternal health care, which means you have better outcomes. It's the wrong side of the argument, and it pushes buttons for people's fears about what's really happening. Late-term abortions should occur as rarely as humanly possible, and they should be only for life-threatening conditions of the fetus or the mother, and that should be analyzed by that physician. If we start making any access points, which we are all around the country, you end up with triggers and 6 weeks, fewer than 6 weeks. These are all barriers to women's health care, comprehensive reproductive health care. And New Mexico is going to stand with many other states to make sure that's not the direction we're headed in.
So your state has become this haven of sorts for the surrounding states that do heavily restrict abortion, like Texas.
And Oklahoma.
So that's, I'm sure, part of your calculus here in crafting the laws you did. But I wanted to come back to something you said, both in February and on other remarks. You talked about using federal lands. You talked about talking to the tribes in your state. You have a large tribal population there. You said we're moving towards tribal nations providing access, including abortion. The Hyde Amendment prevents federal dollars being used for abortion.
But
the White House has not endorsed
but
this.
sovereign land is a whole different designation of federalism and federal land. We aren't doing it now, but I think we will, and I think we can.
How?
Well, a couple different ways. A sovereign nation makes its own decisions. Now, the question that I think you're asking is, would we use Medicaid to actually pay for those services? That is complicated with the Hyde Amendment, so the answer there is no. But we do a ton of state investments, and tribes have their own resources. They're already building behavioral health clinics, they run hospitals, they run primary care clinics. They're already in the business of delivering health care. And at least one of those tribes, a Pueblo in New Mexico, has certainly indicated that they would be more than ready, willing, able, and interested to make sure that access, because women of color have limited access for a number of reasons all over the country. And these are Pueblos who want to make sure that the women and families in their Pueblo or sovereign nation have equal access, irrespective of distances that they might have to travel.
Because last June, Vice President Harris was asked about this, and she said, no, the White House isn't looking at it. Are they looking at it, or is this just you?
Well, I don't think the White House is looking at it, but they have heard loud and clear from a variety of states, including New York, that every federal tool in the toolbox ought to be used to protect and expand access. New Mexico has an opportunity with 23 independent tribes to do that in a little different way. And so the point was, we won't leave any access point, right, on the table if it makes sense, and we have willing partners.
I want to quickly ask you about the water crisis. There's this debate over the Colorado River, which appears to be drying up. It's been drought-stricken for like 2 decades now. Do you need the Biden administration to step in here, because the states aren't settling this?
I think we do, and I think having at least $4 billion, which is an incentive. Look, people aren't going to give up water rights and automatically lean in to do conservation. It's hard, and it's full of risk. The Biden administration, rightly so, got money available to create incentives so that we're doing better conservation and management. You've got 6 states working pretty well together. California, big water user, going to be tough. But with good snowpacks, money, incentives, and cooperation, we're in the best place ever to do something meaningful about this.
Governor, thank you for your time.
Thank you.
Good to have you back.